Hi everybody, it's Brittany and today I'm working at Over the Rainbow. You can find me in the space room right now. It's pretty cool. I'm here to talk to you about the top 5 essentials to have in a first aid kit. First, I'll start off with saline. So saline is a saltwater solution that can be used on any part of the body. I prefer the little bullets like these ones because they stay sterile and they're not contaminated. I love it because it's very versatile. It can be used to flush debris out of eyes, to clean scratches or wounds, and to irrigate noses if you have allergens or something that's bothering you. You can also use it for a sore throat or canker sores to soothe the pain. Second on my list would be bacitracin. This is an antibiotic ointment. You can apply to scratches, wounds, or burns, and it works really nicely on bacteria that likes to grow on the skin. It also helps keep the wound hydrated, like scabs. It'll help keep them moist and help them heal faster. Third, I don't have a sample of it with me, but it would be the Pedialyte electrolyte powder packs. So if you throw a couple of those in there, you know, we're outside playing, it gets really hot in the summer, it's a desert out there. Our kiddos and our infants are at higher risk of dehydration. Electrolytes work by helping your body retain water and regulating fluid balance within the cells. Fourth, I would like to show you is tweezers. So tweezers are important because they can be used for precise removal of foreign objects from the body. Things like splinters, glass, bee stingers, or dirt from a wound. I recommend cleaning the tweezers with an alcohol swab or hand sanitizer before applying it to a wound, just to keep them sterile, or as sterile as possible. And they're a great way to prevent an infection if we're having that embedded item into the skin. They also help too because rather than my fingers, they are easier to remove an object without me creating more damage to the wound. Last I would like to talk about is wound care. So most first aid kits come with band-aids. I have these cool bluey band-aids with me right now. We also have gauze that I recommend. So gauze is good for bigger wounds that might be bleeding for a little bit longer. So basically you take the gauze and you apply it with pressure to the wound, and you keep the pressure there until the wound is completely done bleeding. And in some cases, wounds that are profusely bleeding and spurting blood may require use of a tourniquet. So a tourniquet is a plastic piece that you wrap around the skin, and it cuts off blood supply so that the blood doesn't keep leaving the area. This buys you about 1.5 hours to 2 hours of time to go seek a medical care because that's a medical emergency. So I hope you learned a few things with me. Thank you for stopping by and have a good day. Thank you.